I'm Cassie Sauer. I'm the CEO of the Washington State Hospital Association. Thank you for joining us for our now every other week media briefing. We're really glad that you're here. We have some great panelists with us today. We have Dr. Connie Davis, who is the Chief Medical Officer at Skagit Regional Health in Mount Vernon. She's joined by Dr. Josh Griggs, who's the Chief Quality Officer, also at Skagit. Tom DeBoard is here. He's the COO, Chief Operating Officer at Overlake, and has been very involved in the work on the Microsoft East Side vaccination setting, which I think has been hugely successful. So we're excited to hear about that. And also can talk about what Overlake is seeing in terms of COVID patients. And Dr. Chris Beliga, who is an infectious disease from Virginia, infectious disease physician, not an infectious disease, sorry. Spoke too fast, from Virginia Mason Franciscan Health. And I think can have some great information about variants and what we're seeing as far as transmission and what's happening around the state. So I'm going to start with some opening comments about what we're seeing across the state. I am sorry to say I'm going to be the bearer of some very bad and concerning news this morning. Our panelists will then give some opening comments, and then we'll pause and actually I'm going to take questions for me. I have to go to another meeting to talk about the fourth wave, which is what I'm going to talk about now. So I'm only able to stay on for about 20 minutes, and then Beth is going to facilitate the Q&A. So just so folks can think, if you've got questions for me, our panelists can also probably answer any of your questions. So if I leave before you get to it, no problem. They're all very well aware of what's happening across the state. So I think there is, just to start with, there is no question that we are now in a fourth wave of this disease. The last time we spoke with you, I said we were starting to get worried about it. We weren't sure where the trends were going, but now we have enough weeks of trends to see that we are definitely in a fourth wave. And just to share with you all some hospitalization numbers. So hospitalizations declined in January and February, and then really flattened in early March. And you all know from our discussions with you that we were telling you that they were bumping around 350 hospitalizations across the state. They were like 340, 360, that kind of in that range, but they were about 350 for multiple weeks. I think about 5 weeks. I actually didn't, I would like to go back and check that to be sure, but I think it was about 5 weeks. And so then about 3 weeks ago, we saw the numbers go above 400 for the first time in quite a long time. And then the next week they were at 460 and they were at 500. And this morning, really concerning news, with only 44 hospitals across the state having reported their numbers into the WA Health system, we are above 600 hospitalizations in our state. So for COVID, that is a really high number and a number we haven't seen in months. And so we're really, really concerned about it. There is a very sharp increase, it appears, among younger adults. So folks who are, 30 and in their 30s and their 40s. I think these are largely people who think I will not give that their age is protecting them from getting very sick from COVID. That is not happening. And we don't know if it's the variants or what is causing people to get sicker in the younger ages, but I think we can talk more about that. But a really strong message would be that for folks who are in those age groups, do not assume that you are safe from this disease, because it's making people really sick enough to be hospitalized for COVID. And that's a huge concern. A really, really important fact about the fourth wave is it is stoppable. We are at the beginning of the crest. This looks like the same trajectory we saw in November. Very, very worrisome in November. This is a disease that is totally responsive to behaviors. So for people to wear their masks, keep their distance from others, be very cautious about gatherings, especially indoor gatherings, and get vaccinated. There's been a lot of take up for vaccines in our state, which we're really, really pleased about. But the vaccinations take a while for people to be fully protected. So we're also a little worried. I have to say I have no facts to support this, but this is a kind of an anecdote thing that we're hearing from people, that some folks may have gotten one shot and then sort of feel like the next day they're good, they're protected. I got my vaccine after one shot. They still need to get their second shot, and they need a couple of weeks after that second shot to be fully protected. So it's there's some time here. So for those folks who just became eligible in the last week or so and just got their first shot, they still need to wait and be really cautious. The other piece that we know is that the variants are very prevalent right now. We are seeing a lot of variants, a lot of variant action, and that appears to be part of why the case numbers are going up, that they are the variants that are more, what the Department of Health believes, the variants that are more contagious, and so and reproducing more quickly. So that's another really important piece to be concerned about. But we would love your help in communicating these messages that we are at the beginning of a fourth wave that has the same, we are becoming as worried as we were in November. We're worried for the younger adults. People need to take this very seriously and to really encourage people to get vaccinated. You know, we're so excited that anyone over 16 can get vaccinated. Appointments are available around the state. They're harder to get in some of the more urban counties like King County and Pierce County. I know people have been, some folks I know have driven to neighboring counties with good luck. And so if you're able to do that, that's great. There's waiting lists, there's walk-ups. That I live close to the Seattle Rainier Beach site, and they just announced a program that if you're over 16 and you bring someone who's over 60 with you, you can walk up and you can both get vaccinated. So that's a great option for Seattle residents, is find somebody over 60 and bring them to get vaccinated. So I think there's there is access if people keep at it, and so we hope people really will. So with that, I'm going to turn to our panelists and have them make some opening comments. So why don't we start with the Skagit team, Dr. Davis, Dr. Griggs. Let us know what you're seeing there.
Well, I will just start off by saying that we are seeing an uptick, obviously, in our hospitalizations. One of the things that's a little bit different than earlier waves, we haven't had as many people who've required ventilation on ventilators, which has been good. Although the age of the individuals now who are hospitalized, mostly between the ages of 40 and in their 50s. So it is the younger age group that we currently are seeing. And as far as the awareness, we've been working very closely with our public health department to make sure that everybody is aware of testing facilities as well as vaccination opportunities. And with that, I'll turn it over to Dr. Griggs.
Thank you. Yeah, we are at 10 COVID patients in our Skagit Regional Health facility right now. That is much higher than it's been over the last several months. We're seeing younger, more obese patients. Generally speaking, we're not necessarily needing to ventilate like we did in the past, and we're getting people out. From a vaccine perspective, we're working really hard on vaccine equity. We've been reaching out to specific populations and have an event coming up specific to migrant farmers and the Mixteco speaking population. I'm a little bit surprised that when the vaccine eligibility changed last week that we didn't get a big wave of demand. And from what I'm hearing anecdotally is that, well, my grandpa was vaccinated and my mom was vaccinated, so I don't need to be vaccinated. And, you know, our ticket out of this pandemic, our ticket out of lockdowns and so forth is getting vaccinated. So it's really is important. I also see a lot of focus on just the death. And there's a lot more that this disease can do to you besides kill you, and it can be really long-term sequela. I've been part of our, I've been logistics chief as part of our incident command and watching PPE really closely. And though we're doing well on that, one thing that I wanted to call out is our supply statewide of blood is critically short. So getting out and donating blood is a really important activity to do right now as well. And I'll just leave it at that for now.
Thank you. And I think your point, Dr. Griggs, about even though the death rate is falling, people who get COVID are pretty darn sick and can stay sick for a long time is really important. Like, none of us would want that either. And you know, we've read stories and talked to people who've been sick for a while, are still winded, you know, still can't, they have to limit their activities, still really tired, and that's quite awful, actually. So it's a really good point. All right, Tom, let's hear about what you're seeing at Overlake and how your gigantic vaccination clinic is going.
Yeah, great. Thanks, Cassie, and good morning, everybody. So similar to our colleagues that you have already heard from and from some of the comments from Cassie, we are definitely in our fourth wave, fourth surge. I kind of was looking at the data earlier today, and you can really just see it on the graph all the way going back. We're in month 14 since we had our first COVID positive patient. And, you know, we were really over the last several months seeing, you know, on average in the hospital, anywhere from 4 to 8 patients here at Overlake. and really for the last several months. Even early March, we had, I think, 2 or 3 days where we had 0 patients hospitalized. Obviously, the first time since February of last year that occurred. But slowly, as Cassie said, the numbers have been going back up. And unfortunately, today we're at 17 patients. So again, averaging 4 to 8 over the last several months. And today we have 17 COVID positive patients in the hospital, 3 of them in critical care. So less patients in critical care, but still patients that are sick enough to be hospitalized. And we are seeing younger patients than what we saw in earlier surges. So patients in their 30s, 40s, and 50s are being hospitalized for COVID, where that was not the case in earlier stages. You know, we continue to be very proud of our staff and our providers for the work. Again, this is month 14 since our first COVID patient, and they continue to just really do heroic work every day to take care of our community. And as Cassie said, we are not out of the woods by any shape of imagination. And we really need to ask for everybody to continue to stay vigilant. You know, certainly the social distancing, the masking, the hand hygiene, all of the other guidance that's coming from CDC and Seattle King County Public Health and our Department of Health is really still important because we are not out of it yet. From a vaccination standpoint, again, it's critical for us as a healthcare organization to vaccinate as many people within our community that we can. We did our first vaccination at Overlake back on December 23rd. And through December into February, here at Overlake alone, we did almost 30,000 vaccinations. And then during the month of January, Microsoft reached out to Overlake and to Evergreen and wanted to partner on a mass vaccination site that they would sponsor on their campus. And we have been just so grateful to Microsoft and to our colleagues at Evergreen, and then also Starbucks, who also partnered with us to help with efficiencies of the clinic. And we stood up in about a 3-week period a mass vaccination site that we had hoped could ultimately get to do 5,000 vaccinations a day. And since that site opened on Microsoft's campus in early February, we have to date done over 78,000 vaccines between Overlake and Evergreen at that site. So we're really, really excited. This week alone, we're going to get our largest allocation from the state, where we're probably going to do about 23,000 vaccinations this week. So our goal is to continue to grow that, to do as many vaccines as we can get allocations. I think we can do upward to 6,000 or 7,000 a day if we get the vaccines. So we want to continue to encourage everyone that's eligible to get the vaccine. We know the information that's come out about J&J has maybe contributed to some of the hesitancy that's out there. But I think all of the healthcare leaders, certainly leaders here at Overlake and many of the throughout public health in the state, will continue to encourage everybody that the risk of not getting vaccinated are so much greater than any of the side effects from the vaccination. So we want to continue to encourage everyone to get the vaccine when it's available. So with that, I'll stop, and I look forward to being able to take questions.
Those are great numbers out of the clinic in Microsoft. That's fantastic to hear. All right, now we'd love to hear about what's the view from infectious disease. So, and what are you seeing in Virginia Mason Franciscan Health? I think especially people would be really interested in what you're seeing from the variants.
So hi, yeah, my name is Chris Bollig. I'm one of the infectious disease providers here at Virginia Mason Franciscan Health. And I would echo what everyone has said already. I'll start with the positive, which is our vaccination work that, like everyone else here, has been ongoing since really mid-December. And at this point, across the Virginia Mason Franciscan Health system, we've actually given over 300,000 vaccines, which is great. And of course, Virginia Mason has partnered with Amazon for over 10 events now, where actually this last weekend, we were giving over 3,500 vaccines on both Saturday and Sunday to help immunize people across the state who meet now the expanded definition of those who should get it. Really, is anyone over age 16 should be getting the vaccine. So that's really wonderful work that has just really been inspiring to see. we also are seeing increasing rates of hospitalization in our system. So across Virginia Mason and Franciscan Health, recently we had been averaging in the 60-ish range of inpatients across all of our hospitals, and that's been creeping up. I haven't seen numbers yet for this new week, but was in the 90s by end of last week. And it's the same pattern of younger people being admitted and hospitalized. I looked at the numbers last Monday at Virginia Mason, the hospital that I work at, and we actually had 40% of our cases were under the age of 40, which is mind-boggling to me. We never saw that earlier in the pandemic. We also are seeing less people in the ICU, more people that are sick enough to be admitted and can stay for a while. And I know deaths are down, but I had a patient who passed away over the weekend. It's still happening, and it's still heartbreaking for me as their provider to see these events happening. And what else? The other comments people have mentioned. This is a preventable disease. If you are vaccinated, it works really well. And even if it doesn't work at keeping you from getting sick, it can keep you out of the hospital, or it can keep you from dying. I mean, that's a tremendous win for a vaccine. And you can also do what you can do to not catch it. There's responsible behavior, if you will, of being diligent. Wearing your mask in public, wearing your mask around other people, trying to avoid unnecessary exposures, not taking that trip if you don't have to, staying away from people when you're out and about. Washing your hands, all of the advice we've been giving since the beginning is still important. And I know, and I personally feel the desire to walk back and relax and let our guard down. And we are so close, but the virus is still out there. It doesn't care. If you have it and can spread it, and there's a person who can catch it, it's going to happen. And so we all have to do our parts to try to keep that at bay as best we can.
Thank you. So as I said at the beginning, I actually have to go to another meeting to talk about the fourth wave and what we're going to be, how we're going to be working collectively as hospitals on it. So I'll just pause here to see if there's any specific questions for me. I see the questions in the chat. I think the panelists are perfectly capable of answering them, probably more than I am. Is there anything that anyone wants to ask specific to me? Okay, so I'm going to hand it over to Beth Zabrowski, who leads our communications and membership work, and so Beth's going to facilitate the rest of the press conference. Thank you all so much for joining us, and as always, if you've got questions for us, let us know. I think it's worth tracking those WA Health numbers this week to see where they go for the hospitalizations, because the fact that we're at 600 this morning with only 44 hospitals, we have 115 hospitals in the state reporting, is very, very alarming. So keep track of that for sure. Thank you so much for joining us.
All right, we'll go to questions in the chat. The first one is, we're hearing that tens of thousands of vaccine appointments are available, but no one has taken yet. Do we have any idea how many people are choosing not to be vaccinated? And how concerning is this as we look toward our goal of herd immunity? So I will answer a little bit of this and then open it up to the panel. I think we don't yet know how many people are fully refusing, because we're still in the early days of the opening of the phase, but I think it is really enlightening to hear from our panelists as far as what they're seeing with the opening of the new tiers and accessibility for anybody 16 and over. Not seeing that wave up in Skagit County, I'm wondering what you're seeing in your community and what you're feeling as far as people who are just going to decline to get vaccines at all.
Well, I think we can extrapolate from some of the information that we have from our healthcare system for those that have decided that they're not going to be vaccinated. It's between 20 and 25%. And many of them who have decided to decline are waiting for a little bit more information about the vaccine.
Anyone else want to join in on that?
Yeah, well, and I'm hearing over time that, or at least initially, there, people claiming that it was a rushed process, which it wasn't, and that we didn't have data, which we did. But now, as we get more and more people vaccinated, we have so much more data and so many millions of people that have been vaccinated. So that becomes less of an argument. What I've been telling people is, at this point, it's your civic duty to get vaccinated. It's just one of those things that you do, and it's a courtesy to the rest of the world.
To your point, Dr. Griggs, about the development of this vaccine, I wonder if you or Dr. Balaga would like to talk a little bit about how the mRNA vaccine was developed, and that there's actually been research being done on this kind of coronavirus vaccine for many, many years now.
Yeah, I mean, I can take that. The vaccine, this is the first widespread implementation of this type of vaccine, but it's been in studies for, I think, over 20 years at this point. It's not really a novel new thing. The only reason that we hadn't seen it yet in other vaccines has been cost of really bringing this from the stage of clinical trials to where you can immunize large numbers of people. So I did not have any concern about the vaccine from a safety standpoint when it came out. I got it. Everyone who's eligible in my family has gotten it, and as soon as they allow us to immunize younger children, my younger children will get it. So I do believe that it's safe and it's the right thing to do.
And Beth, if I could just jump in quickly and just make a comment. The way that the studies were performed, it was different timelines than what had been used in the past. I mean, they followed all the appropriate steps, but it was really the focus that was put nationally and internationally on this process. So they got all of the individuals engaged in the manufacturing and in the clinical design arena, and made a concerted effort to get it done. It wasn't short-sighted, it wasn't short-circuited. Every single part of the process was completed.
Thank you. I think we can't say that enough. And I tell you, if there were vaccine trials here for me, my kids would be in them too. So we do have a couple of questions about the Johnson & Johnson vaccine. One is that there's news that a man in California has developed clots after getting the vaccine. According to the reports, he's going to be okay, but the reporter is wondering about thoughts on vaccine hesitancy when it comes to this vaccine, and words of encouragement that you can give people who might be worried specifically about that vaccine.
Well, I'll jump in. There are risks with everything in life, and the risks of side effects with really any of these vaccines, of which Johnson & Johnson included, they are there, but they're small. I mean, I think the risk that I took driving to work this morning and then driving back home to do this this briefing was higher. The chance of me getting in a car accident was higher. The chance of me getting hit by lightning actually is higher. The risk of getting COVID and either, if you're lucky, just infecting other people, or if you're unlucky, getting sick, getting hospitalized, getting into the ICU, or dying far outweighs the risks of any of the complications that have been rarely noted with the current vaccine group. I think everyone should just get vaccinated. That's the answer.
I would ask Chris too, the fact that people that have the virus in the hospital, many of those people develop clots. And so when you're looking at the trajectory of the individual, if you get sick, you're going to have a very high risk for having thromboembolic events.
Yeah, up to 50% of people admitted to the hospital with COVID, if they were to get a CT scan looking for a clot, will have it. So it's a real risk of getting COVID as well. Again, COVID far worse than any of these other risks.
I'd just add that the clots are treatable as well.
Beth, this is Tom, and I would just add from our perspective is the same thing. All of our clinical leaders, our infectious disease leadership, our chief medical officer, et cetera, all of them are continuing to educate both our employees, our providers, and certainly our community that the risk of not getting vaccinated certainly far outweigh the risk of getting vaccinated. There are risks with everything, but we know people are getting very sick with COVID. People are dying. We had another death at Overlake last week after going a long time without one, and you just heard from others that have also experienced that. So again, we strongly encourage everyone. I think Cassie has always used the phrase, the best vaccine for you is the one that's available. And we would strongly encourage everybody, again, even though there's risk with everything, the risk of not getting vaccinated far outweighs it.
Absolutely. Another question that's related is, how many doses are currently allocated to hospitals of the J&J vaccine? How many are currently saved? And do we foresee a problem using all of those we have? I would say that hospitals have not been getting a lot of J&J vaccine to begin with because it doesn't require the cold storage that we are able to do with the other vaccines. So it's been going to other institutions for the most part. Also, the amount that came into the state was much lower than both Pfizer and Moderna. And with some of the production issues that they had that was even reduced further. I think as far as how many doses are currently being held, that would be a good question for the Department of Health. But I don't think that there is a lot in hospitals that is not being used. And I think there's still the the convenience factor of the J&J vaccine, that you have a 1-dose vaccination that is still going to be attractive to some people who want to get that protection. I don't know from our panelists, do you have any thoughts on this question?
Beth, this is Tom. We at our site at Redmond, we don't have any J&J now. We have administered J&J. We can administer all 3 of the vaccines that are available and have at our site at Redmond. The vast majority of what we're administering is Pfizer. The county has actually received, prior to the pause, had received some J&J. Like you said, it wasn't a lot, and we did administer some, but we don't have any now, and we don't have any allocations for it. We just, whenever the county asks if we have an ability to administer them, we've done that in the past, but we don't have any at this point.
Same here at Skagit. We haven't received any Johnson & Johnson. We've indicated that we're willing to accept it, but it's mainly being reserved for the pop-up clinics and the retail pharmacies and things like that.
Yeah, Virginia Mason Franciscan Health, it's a sliver of what we've been giving.
Great, thank you. Here's one that I'd love to hear from all of you on. Are you seeing people missing their 2nd dose appointments? There were some national stories about this weekend. If so, at what rate, and what are your thoughts on this?
Beth, this is Tom. For our Redmond site, I don't have a specific data as far as the numbers, but it's been extremely low of people not showing up to get their 2nd dose. We did have issues with no-shows relative to 1st doses because many people would sign up at multiple locations and just grab whichever the first one they could get. But our experience has been that whenever somebody gets their 1st dose at our site, we schedule their 2nd dose before they leave the building, and the no-show rate has been almost non-existent for us.
Yeah, I would second that. We've seen pretty much the same thing. It's pretty uncommon, and they're very excited to come back and see us again.
A chance to see people.
I agree. I think if people are missing the 2nd dose, the most common reason that I've heard and this was true earlier, I haven't heard this in a while, is that they were able to get their 1st dose somewhere. They weren't scheduled for a 2nd dose, and then they didn't know how to do it. And so they were kind of swirling until they were able to find a place to give it. I think that process has improved across the board.
I agree. Thank you. And this is a question for you, Dr. Balaga. What are you seeing in terms of variants in the state, and how much of an impact do you think those variants are having?
I think they're having a tremendous impact. The dominant variant in the country at this point is the B117, which is more contagious and potentially more likely to make you ill. That to me is the single most important thing in driving the increased numbers right now. We're lucky that we've seen the dramatic decrease in hospitalizations of the older population that we were seeing earlier, and that likely has a lot to do with the fact their vaccine rates are much higher, which again just goes to show in my mind the impact the vaccination can still have. These variants, they're circulating, they're there, they're going to continue to be there. The most important thing we can do to stop them from appearing is to get immunity up so that you just don't have that rampant replication over and over again where the mutations can occur that lead to the variants.
Related to that, there's a question about, do we know how the variants are linked to increasing hospitalizations? And I guess there's probably a number of factors that are driving the increase in hospitalizations. Do you have thoughts on that?
I think they're driving it. I will say that we don't have visibility to what strain of COVID our patients have when they're in the hospital. This is all data that's kind of compiled after the fact at the state level. So I can't tell you that X% of the patients that I saw today had a particular variant or not. But in my mind, I think that's what's driving a lot of what we're seeing, especially in the younger population.
Anyone else have thoughts on that?
Well, it seems like it is intuitively obvious that that would be the case. Although I must say that, and I would ask Chris, as far as the data that comes out from the Department of Health, in Skagit County, we've only had 2 variants that have been specifically identified. So we don't have the correlation between the people we have in the hospital and the variant genomics.
When I see a related question around why it was moving to younger patients and if that has to do with the variants, and so we might as well just move on to that one. I think it's a combination of what we just heard, as well as the fact that the younger population has really got this pandemic fatigue and not necessarily doing the social distancing and masking and so forth, as well as the fact that our older population was rushing to get the vaccine, and we've got a good portion of them now vaccinated.
There's another related question about that there are more women that are vaccinated than men, and factors that might be driving this trend in Washington and actually nationally. Any thoughts there?
Women are smarter than men? I don't know. I mean, this is true across a lot of healthcare issues. Women tend to be more engaged in their healthcare, pursuing treatment, preventative treatment, than men do. I think it's similar to that. I don't know if there's any bigger answer out there.
Thank you. How long are they recommending that people wait to get vaccinated after COVID-19? Either Dr. Baliga, perhaps, or Dr. Davis?
Yeah, after having been infected with it. So the guidance for how long to wait, it really is to just not be contagious. That's the minimum that's been set by the CDC. And so for most people, that's 10 days from the onset of your symptoms. I will say that there's been talk from the CDC about you could wait up to 90 days because reinfection within 90 days is thought to be unlikely or rare. And that is still a true statement. As vaccine supplies open up and wait lists go down, I think that becomes less of an important issue. That was really trying to help prioritize people to get the vaccine who hadn't already had COVID or at higher risk. But as long as you're not contagious, you can go and get vaccinated.
Excellent, thank you. That is all the questions that we had come in through the chat. Would anybody like to ask a question live or send in additional questions through the chat?
Hi, Beth. This is Evan Bush of Seal Times. I actually have more questions than I can type. So this is for Dr. Baliga, but the city of Seattle sent out a news release last week suggesting that the city could reach community immunity by the end of May. And then the number that they put out there was 70% of adults receiving vaccination. I'm wondering if you view that as realistic, particularly with variants spreading and transmitting as rapidly as they are. I'm also wondering what you believe the herd immunity threshold is at this point with variants. I know that science is unsettled, but just trying to give people an accurate sense of what's possible. Also curious if community immunity is possible from a local sense.
So I think what the county was trying to get at was we'll have enough vaccine to immunize everyone that needs it to get our numbers up to around 70%. So in terms of the variants being there, that shouldn't really impact our ability to immunize our population. And so the good news with all of this is that as vaccine supplies increase, as we have more and more venues for people to get vaccinated, the ability to get everyone vaccinated is out there. And of course, we want to get that number as high as we can, as quickly as we can. In terms of what the number is needed to stop the pandemic, you know, I know I've heard 70–80% numbers quoted out there. I don't want to second guess the expertise of the people that did it and the numbers they've come up with. I would just say higher is better than lower. And we've got to get those numbers up as high as we can. You know, I like to think when we think about people getting vaccines, there's the group that wants it. And I know in some areas, everyone who's wanted it has pretty much gotten it. And those are the areas that have pretty, walk in and get your vaccine right now. There are other areas where not everyone who wants it has gotten it yet. I think that applies to the more populous counties here in Washington State at this point. Then the people that just don't want the vaccine. They're the ones that we really need to get to say, please get vaccinated, because there is going to be a group of people that can't get the vaccine or can't get the full vaccine. They have medical reasons not to do so. And they're the ones that we really need to get the numbers up to protect them as well. So it's a very similar argument as we use for influenza during flu season to try to encourage everyone to get vaccinated. I like the "it's your civic duty" comment from before. We just have to get those numbers up as high as we can, as quickly as we can.
And Evan, did you have a follow-up question there?
Yeah, I think it is kind of a confusing time for the public. We have variants rising, hospitalizations rising, at the same time vaccination rates are rising, and I'm wondering, Dr. Paliga, if you wouldn't mind sort of looking into the crystal ball over the next 4, 5, 6 months, and what factors are you paying closest attention to that will determine our course in the pandemic? Is it vaccination rate? Is it the effect of kids going back to school? Is it the variants? What are the 5 or 6 things that you're looking at that will help determine our course over the next several months?
So it's vaccination rate for sure. I really want to see the vaccination rates go up. I want to see the case numbers going down. I want to see vaccination rates internationally going up. I think there's a lot, the messaging here today really is what can we do in Washington State to fight this, and getting vaccinated, behaving responsibly are the 2 most important things that we can do. But at the end of the day, there's still the pandemic raging across the world. And I really want to see the numbers internationally starting to come down, the vaccine rates there going up. It's like a wildfire. If you leave it to just the impact of getting infected and surviving as the driver of our herd immunity, it's going to have to blow through most of the population of the entire planet before we're going to be at a better place. The beauty of modern science and vaccine science is that we can give you that immunity without having to be infected. But we've got to roll this out both locally here, but we've also eventually got to move this to the international stage.
Thank you. We do have another question that's come in through the chat. And this is, what are panelists seeing in people in their 20s and 40s? Specifically, it seems that they are sicker relative to earlier in the pandemic. I wonder if we might start with Tom on this one.
Yeah, I mean, it's a great question. I think as I had indicated earlier, we're definitely seeing younger patients sick with COVID and being hospitalized, 30s, 40s, 50s. And I think it's, again, I'm not a clinician, but certainly what I've been hearing and certainly reading about is that, as I think Dr. Paliga mentioned earlier, the kind of COVID fatigue is certainly settled in this group for sure. People are letting their guard down. This is a group that earlier in the pandemic, schools were shut down. A lot of people were working from home. People truly were staying home. And you would always hear about everybody that was quarantining. And, I think at that time, our elderly population, a lot of those in the nursing homes, et cetera, were really the ones that were the sickest and in the hospital, and most of the deaths. Now, many of those elderly are vaccinated, and we are seeing this group of younger folks that aren't as highly vaccinated yet, and less likely to follow some of the guidance that's out there. And I think it is having some impact on those we're seeing in the hospital.
And how about you, Dr. Davis? What are you seeing as far as, are you seeing these folks be sicker than they were earlier in the pandemic?
Well, it really depends on some of the patient characteristics. And the younger folks who are ill, the most common thread is obesity. And we have transferred 3 people in their 20s for ECMO therapy, meaning the extracorporeal oxygenation. And so right now, although the most people are not as sick as they were earlier, some of them do come in and they're extremely ill.
Thank you. Dr. Paliga, anything to add from Virginia Mason Franciscan Health?
I've been talking a lot about this internally, and even with King County Public Health, in terms of what is happening with the younger population. And because we didn't see these numbers before. We had younger people that were admitted and were very sick with COVID, but the proportions have definitely changed. Some of this is the immunity in the older population. And again, that's just proof that the vaccine is still being effective. In terms of why we're seeing sicker younger people, I think that probably is the impact of the variants that are out there now versus before, where they are more contagious and a certain fraction of them are more likely to be sicker, and that's what we're seeing.
Thank you. With patient numbers going up again, are your issues with exhausted workforce shortages resurfacing? And I'll go to maybe Dr. Griggs to take a first swing at this.
Yeah, I mean, our workforce continues to feel stressed. You see it when you're out on the floors. And it's not really just with the nursing folks. I see it in administration. I see it in just kind of across the board. We're able to fill out our slots, and we're not short of nurses right now. But some of the other areas we're seeing a lack of like several job openings, that just seems like an exit of the healthcare industry, or just a lack of people seeking jobs at the moment.
And Tom, how about at Overlake?
Yeah, I would say, again, we're experiencing similar things that our colleagues are experiencing around the state. Our staff is tired. As I indicated, this is month 14 that we've been managing this COVID pandemic. And so clearly folks have worked very hard, and obviously many months of very stressful times of managing COVID, certainly early on. And as we've gone through a few of the waves, things have certainly settled down, and up until this newest fourth surge, we were, what I would classify as really pretty stable relative to managing it. But with that said, we've had challenges. There's folks that have, decided, and again, not just nurses, but other clinicians and even other support people in environmental services or other categories that have decided that this, maybe just isn't what they signed up for. We have healthcare clinicians as well as other folks within our workforce that have had to leave the area, move from this area to another part of the country because of needing to be around family to be able to help with daycare, childcare, or homeschooling that they just weren't able to do on their own. And so we've seen a little bit of all of that. I wouldn't say it's necessarily resurfacing. I would say it's been a challenge for the last many months for us, and just continues as the pandemic continues to go on.
Thank you. And Dr. Baliga, I know you said that it sounds like you were doing some direct patient care too. I wonder if you might give your perspective on what it's like to see these waves coming and not know if there is going to be another one after the wave you're in settles.
It's challenging. Is there fatigue for doing this? Fatigue's a strong word. Do I wish that it would let up and go away? Absolutely. You go to work and you wonder how many COVID patients were admitted overnight. What's happening? How did my patients do? Are they better? Are they worse? That of course, in healthcare, that's what we do every day. I mean, it's in a way, it's been inspiring to work alongside all of the teams that have been involved in this, and it has been everyone. I mean, it's from the nursing staff to the lab staff to the administrators. This has impacted all of us, as I know it's impacted every single person in the country. From my personal perspective, I very much look forward to the day when I'm not worried about COVID in the hospital. I'm not worried about COVID in the community. I'm not worried about going to a restaurant or taking a vacation. Like everyone else, I want that day to happen. But at the same token, I want to keep doing my part to reduce the numbers that we're currently seeing and keep as many people out of the hospital as I can.
Yeah. Beth, if I could just add a couple of things. First and foremost, I think people are just really tired of this being part of their everyday life, and you add it on top of everything else that they're trying to do, and it is very hard to accomplish. The other thing is that what we're seeing now is an increase in the acuity of individuals who are presenting even without COVID, whether because they've been delaying care for other reasons or what. But what we're seeing in our emergency rooms and the acuity of people being admitted is markedly increased.
And Dr. Davis, following up on that, are you seeing that, do you think, because of delay in care and people not seeking regular care?
I think it's a couple of things, but I don't have data to really support it. I think the delay is real. The other thing is, you know, telemedicine is a wonderful thing, but at this point in time, you still can't listen to somebody's chest through the telephone very well. And so people, oftentimes they will come in, and then there's more to the story when you actually have an opportunity to do a physical exam.
So as we have throughout the pandemic, we are encouraging people to continue to get the regular care that they need for chronic conditions and going in for regular physicals and keeping in contact with your primary care provider to stay healthy outside of COVID as well. Any other questions from the media while we are on the line here? You can ask it, unmute your phone line and ask.
I had a question. This is Jessamine McIntyre with Q13 Fox. I was going to ask Dr. Davis, and by the way, I just appreciate you guys doing this. You've done it every week for a while, and now I know we're bi-weekly. I appreciate all your time. Dr. Davis, you had mentioned a significant notice in blood clots in COVID patients. And now that we're seeing the Johnson & Johnson vaccine show evidence of that, I know it's a little early to say that there's correlation, but do you see any? And I know I'm directing this question to you, but I'd like other doctors to weigh in as well.
Is the question a correlation with the vaccine or the infection and thromboembolic phenomenon?
It is the vaccination is the one that's different than both of them. It's the only non-mRNA one. And I'm wondering if you think there is a correlation or if you've seen one.
We haven't seen one because we really haven't administered the J&J here in our organization. Will there be? There may be, but like we were talking about earlier, and I'll have Chris really add the expert commentary here. There is a correlation with the infection itself, which I think is more significant than actually that with the vaccination.
Yeah, we've been talking about this a lot just internally. You know, what is it that's different about the vaccine, the J&J vaccine or the AstraZeneca vaccine, which of course isn't yet available in the United States. It's all speculation. It's too early to really say anything definitive. The virus itself has a risk for clotting. It's a higher risk, obviously, than the vaccine, where it's exceedingly rare. But is there something about the virus and the components that are being used in the vaccine that might increase risk? I don't know. The disease itself has such a high risk of it, and whether that's because they're critically ill or they're lying in bed in the hospital, all of which already increases your risk of blood clots. It's really hard to say.
Thank you. One more question coming in through the chat is, are there any hospitals close to stopping elective procedures again? I will take a run at this and love to hear your perspectives from your facilities. The Washington State hospitals have cooperated with each other throughout the pandemic to ensure that none of them go into crisis. And I think similarly, they have also been working together to make sure that there isn't a hospital that's overwhelmed so they aren't able to give regular care. And so I have not heard that there are hospitals that are approaching a need to really make significant adjustments. And I do not believe that there have been a lot of cross-state transfers at this point either with this wave. But again, we are watching that very closely, and we'll be keeping in communication with folks at the state and with our members to ensure that care is able to continue to be delivered. And we all have a responsibility to continue social distancing and getting vaccinated when we can to help stem this fourth wave. As Cassie said earlier, this is completely preventable. We can stop this from growing into something much bigger. Anyone else have comments on how you're delivering care in your own facilities?
Yeah, Beth, this is Tom. We are not at a point where we need to consider stopping any elective procedures. It is something we monitor every single day. Obviously, we manage our bed count every single day. Even though our COVID census is up, it's certainly not to the level where we're at that point. We look at it all the time. We make sure that we have the appropriate staff in place. We make sure we have the appropriate PPE and other supplies necessary. And we are in such a better place today than what we were obviously earlier in the pandemic, and have prepared ourselves like everybody else has to be able to weather these additional surges. And like Beth said, it has been really, really great to see the collaboration of providers all across the state to help each other out. We've taken transfers in the past. We have not had one in quite a while, but it has really been great to see everybody collaborating as necessary to just make sure we take care of patients.
Yeah, I would support what Tom is saying. We do not have any plan at this point in time to stop our elective procedures. We have a process that's been put in place with the learnings over the last year as to how to monitor all of the scheduled cases and juxtapose it against what we have in the hospital and the staffing needs. So right now we are doing well. We also realize that by delaying some procedures, there are harms that can be, caused for patients, and we really want to make sure that we minimize that.
Yeah, Virginia Mason Franciscan Health, we have the ability to transfer within the organization, and at this point, we're not at any concern where we need to be worrying about canceling any kind of procedures.
Thank you. And I think that is, we have representation from Western Washington today on the panel. I believe that is also the case across the state on the east side as well. Other questions that might come in either via chat or voice? We have a couple minutes left.
This is Evan Bush again. I'm wondering with B117, that's the variant we're seeing in greater proportion. At one point, there was thought that not only was it more transmissible, but also that it could result in more severe outcomes. But what is the latest science on that? And is that still the belief, or has that changed?
I think that would be for Dr. Balika.
Yeah, that's still the belief, and I think that's what I think I'm seeing in terms of our patients that are younger and sicker than we've seen before.
And Evan, I know you had a long list of questions. Have we gotten through them, or are there some more?
I would be curious about children and the impacts of return to limited return to school for some. What do we think the impacts of children being, I guess, a little bit more in the community at this point might be having?
So, there was data from, earlier showing that the rates of infection in schools were really mirrored very closely the rates of infection in the community, and suggesting that schools were not a main driver of numbers. So I'm hoping that's true. I think that's true. I'm one of the people that believe the benefits of having kids in school is greater than the potential risk. But as we bring our kids back to school here, as the rates are going up, I'm hoping that it'll be a non-event.
I guess does B117 though change that equation a little bit, being more transmissible?
I don't think so, because I think it's equally transmissible in the community. So I think it'll be the same thing that you'll see, that the rates of infection in schools will mirror very closely the rates of infection in the community.
I have a follow-up on that. I'm just wondering if you think that contributes to the rates rising.
The schools are back in session.
Yes, you said they mirror each other. I'm just wondering which side of the mirror you think it is.
I don't think it's impacting it. This is my personal opinion. You have to ask public health what the data that they have available shows.
I would like to jump in and say that, schools are extremely important for the children's development. We've had a quite significant impact of what's been going on the presentation of pediatric patients to the emergency room with behavioral health issues.
Are other hospitals seeing that as well? Overlake or Virginia Mason Franciscan Health, are you seeing increase in adolescent and children coming in for behavioral health issues?
Beth, I don't have the data here for Overlake, but certainly in conversations with our clinical colleagues, the impacts from a behavioral health standpoint for certainly adolescents and even adults has certainly been significant, and something that we've monitored. Our behavioral health unit that we have at Overlake is an adult unit, so we're not really seeing adolescents or children here, but I can imagine that the impact is significant, just as she had indicated.
Yeah, at Virginia Franciscan Health, I don't have data on it either. Anecdotally, I would agree with that.
This is Evan Bush again at the Times. I'm wondering, obviously the Pfizer EUA for 12 to 15-year-olds is in, and they could get vaccinated maybe as soon as this summer, depending on, obviously the federal regulators. Wondering though, your perspective on the 6 to 10-year-olds, those clinical trials aren't done. What timeline would you expect for those children at this point, given, what we know publicly?
I think Dr. Balaga is probably the best qualified to answer that question, maybe.
Well, it depends. It's how quick they get the trials done. As rates are going up in the US, and depending on where they're doing the trials, the more transmission that they have occurring, the faster that they can accrue the numbers they need to show that there is benefit, that it does work, as well as looking for any potential adverse events that may be out there. So I would expect, I'm eagerly waiting guidance to change to lower the age that it's given. And in terms of the even younger ages, I know the trials are ongoing. I don't have any more insight than that.
Thank you. All right, we are coming in at 2 minutes to the hour. Are there any last questions before we let our panelists go? All right, thank you all for being here. Thank you, members of the media, for continuing to cover this and add new perspectives and encourage people to continue their social distancing and to get vaccinated. And thank you so much to our panelists for taking the time today. We'll see you in 2 weeks. We will go back to weekly if the news cycle merits it and we have enough news to share with you. Otherwise, we'll see you in 2 weeks. Thank you so much.